Hi from Boston. I'm Dr. Nina Gold. Thank you very much for the opportunity to present my proposal, Identification of Undiagnosed Adults at Risk for Treatable Genetic Disorders. Although they are individually rare, genetic conditions collectively affect an estimated 10% of the population. Fortunately, advances in research have led to the development of treatments for over 800 of these conditions, dramatically improving the survival and quality of life for people with rare disease. But we can only treat the people whom we first diagnose. Biobanks are a key resource for identifying undiagnosed people at risk for genetic conditions. In my work, using a multi-center hospital-based biobank, we have uncovered people of all ages at risk for hereditary cancer syndromes, hemophilia, and multisystem diseases, people who stand to benefit from early surveillance and intervention. This proposal builds upon that foundation, focusing on a group of conditions that are particularly difficult to diagnose in adult patients: inherited metabolic disorders. These are classically thought of as pediatric diseases, but growing evidence suggests that they are underrecognized in adults due to their rarity, heterogeneity, and the overlap in symptoms with more common conditions. In our prior investigation of 54 genes linked to treatable conditions, we identified disease-associated variants in approximately 1 in 650 people in our hospital-based biobank. Remarkably, more than 70% of those people were either misdiagnosed or undiagnosed at the time of discovery. We recently replicated both these prevalence studies and the estimates of underdiagnosis in the UK Biobank, which contains genetic data from nearly 500,000 participants. For the proposed study, we will significantly expand our scope to encompass over 100 genes associated with treatable inherited metabolic disorders. We will first identify biobank participants carrying pathogenic variants, then conduct detailed reviews of their electronic medical records, and finally recontact living, undiagnosed people to offer dedicated clinical evaluations. These evaluations will enable comprehensive phenotyping and, importantly, connect people to appropriate subspecialty care. To assess disease expression, we will design a scoring tool using prior literature, and 2 biochemical geneticists will independently assign disease severity scores. This approach is designed to generate immediate clinical impact while informing future screening paradigms. We expect to find that participants will have a spectrum of disease-associated symptoms, and some will present with classic features of disease that were previously unrecognized, highlighting missed opportunities for diagnosis, while others might be asymptomatic, offering important insights into variant penetrance and the appropriateness of these genes as targets for population screening. To strengthen the generalizability of our findings, we will again replicate prevalence and phenotype assessments in the UK Biobank. The implications of this work extend well beyond individual patients. Our findings will help define the clinical utility for genomic screening for a variety of rare disorders. By identifying which genes and variants are most predictive of clinical disease, we can optimize future screening strategies for both pediatric and adult populations. Furthermore, this project aligns directly with the priorities outlined in the National Academy's Consensus Report, Improving Diagnosis in Healthcare, particularly the call to leverage health information technologies to support clinicians and enhance the diagnostic process. In the future, I hope this work will also contribute to the development of tools that support screening for the early detection of disease in pre-symptomatic people. In closing, this proposal represents an opportunity to translate genomic research into meaningful improvements in patient care while also laying groundwork for the future of genomic screening. Thank you again for the opportunity to present this proposal, and I hope to have the chance to join this year's cohort of National Academy of Medicine Scholars in Diagnostic Excellence.